Knock, knock.
Enter.
Hey, Ronnie, good morning. My name is John. I'm going to be your student nurse for the day. I am going to do your full head to toe exam. And let me wash my hands real quick. And close the curtain for privacy. And so could you please give me your hand? Could you tell me your name and date of birth, please?
Ronnie Patrick, May 1994.
All right, thank you so much. So this video is going to be recorded. Is that okay with you? All right, so like I said, it's going to be a full head to toe exam, and I am going to inspect various parts of your body, and some of them, we're going to assess some of them, and you're going to use some of them. So I will begin my general survey. Of course, I asked my patient to give me his hand, and he gave it to me, so he was able to follow directions, and the patient age that was stated matches the patient appearance. Do you know where you are? What's the address?
1105 Lincoln.
All right. What's the date today?
28th.
And what's the time?
8 p.m.
All right. So my patient is alert and oriented to date and time and place. So I am going to begin with your skin. I am going to assess the parts of the skin that I can see. I can see his shoulders, I can see his neck, I can see his face. And this would be, my patient would be having a journey on, but for purposes of this video, he's going to keep his clothes on. So I am going to inspect the skin. Do you have any rashes?
No.
Any skin breakdown?
No.
So I'm going to inspect for any lesions, any scars, any lacerations. And upon inspection, the skin color matches ethnicity. There is no lesions, there is no lacerations. So I'm going to move on to the hair, and I am going to inspect the color, texture, and distribution. And upon inspection, I see a full head of hair, and I don't see any areas where the patient is losing hair. I am going to move on to the head. Do you have any headaches?
No.
Any pain?
No.
All right. So patient denies having any pain, and I am going to inspect the head. I'm going to inspect for size and shape of the skull. I'm going to inspect for any lesions, any bumps, I'm going to inspect the facial features for symmetry, and I don't see any lesions. There is no bumps. Could you please frown? Could you smile? Could you show me your teeth? Could you stick your tongue out? Could you puff your cheeks out? All right, so the facial features are symmetrical, and stick your tongue out again for me. All right, cranial nerve 7 is intact. So next I'm going to palpate the head for any tenderness, any bumps, any masses, and I am going to palpate the temporomandibular joint for any crepitus, and tell me if you have any pain. Do you have any pain?
No.
All right, and the temporomandibular joint, do you have any pain?
No.
All right, so there is no crepitus in the TMJ, and I am going to assess cranial nerve 5. So I have two objects. One is going to be soft and the other is going to be sharp. Could you please close your eyes for me? Tell me what you feel, either soft or sharp, okay?
Sharp. Soft. 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 Sharp. Sharp.
Okay, so cranial nerve 5 is intact. I am then going to move on to the eyes. Any change in vision?
No.
All right, so I'm going to begin by inspecting the external eye structures, the eyebrows, the eyelids, the eyelashes. I'm also going to inspect the sclera and the conjunctiva for any crusting or drainage, and I'll grab my pen light. So I am also going to assess the shape and the position of the pupils. So upon inspection, could you open your eyes, please? The conjunctiva is white and moist. The sclera is white and moist. The conjunctiva is pink and moist. And the external eye structures are symmetrical. And the shape, the size of the pupils is 2 millimeters according to this pen light. So next I am going to assess for direct, because I'm going to assess for accommodation. I'm also going to assess for convergence, cranial nerve. I'm also going to assess cranial nerve 6 and cranial nerve 4. And could you please look at this pen and look at me and follow, find my arms. You see me and look at this pen again. Look at it with your eyes. The patient is able to follow, and there is convergence right there, and there is pupillary response to light. All right, so the again, the external eye structures are symmetrical, and his pupils are equal, round, and reactive to light. And I don't see any nystagmus. I am then going to move on to the nose and the sinuses. Do you have any? Is there any change in smell?
No.
All right. So I am going to begin by inspecting skin color. I'm also going to inspect for any lesions, any lesions, skin color changes, any scars. And upon inspection, the skin color matches ethnicity, the nose is midline, and I don't see any scars. So next I am going to assess for patency of the nares. Could you please occlude one nostril and blow out with your eyes closed, and this side with your eyes closed. All right, so there is patency in both nares. So next I'm going to palpate the external structures of the nose for tenderness, and then I'm also going to palpate the frontal and the maxillary sinuses. And do you have any pain?
No.
All right. All right, so patient denies having any pain, and there is no tenderness or masses in the sinus area and the external nose. Next, I'm going to move on to the mouth and throat. Are you coughing?
No.
Any choking while eating?
No.
Any difficulty swallowing?
No.
All right, so I am going to inspect the lips, the oral mucosa, the gums, the gingiva, the tongue, and the floor of the mouth. And could you smile, please? Could you pick up your tongue, lift your tongue up, lift it up. Okay, and could you open your mouth and say Open your mouth again and say Okay, so there is equal rise of the uvula and the palate, so cranial nerve 9 and 10 are intact, and the tongue is midline, and it's symmetrical. And could you stick your tongue out and move it for me, please? Move it side to side. All right, so looking at the lips, I don't see any fissures. He has full dentition. The gingiva is pink, the tongue is midline, and cranial nerve 12 is intact too. So next I'm going to move on to the ears, and any recent changes in hearing. All right, so I'm going to inspect for skin color, any lesions, any scars, and I'm going to inspect the external ear structures. So upon inspection, I don't see any lesions, there is no scars, and the skin color matches ethnicity. And I am going to assess for patency by doing the whisper test. I am going to say a 2-syllable word, and could you please repeat after? Could you please say what I just said to you? Close one ear.
Popcorn.
And
Popcorn.
all right. So and I am now going to palpate the external structures of the ears. And do you have any pain?
No.
All right. So there is no tenderness. Patient denies any pain. And cranial nerve 8 is intact, and the auricles and the pinnas are symmetrical. I am now moving on to the neck. Any neck pain?
No.
Any changes in your voice?
No.
All right, so as always, I'm going to begin by inspecting for any skin color changes. I'm going to inspect for any lesions, I'm going to inspect for symmetry, any enlarged thyroids, enlarged lymph nodes, any new nodules. And upon inspection, there are no enlarged thyroids, the skin color matches ethnicity, there is no scars, no lesions. I am also going to inspect for any jugular venous distensions. Could you please turn your neck to the other side? And to this side, please. I don't see any JVDs, and I am going to assess range of motion for the neck. And I am going to begin with, I am going to assess for range of motion for the neck. Could you look up to the ceiling, please, and look down? Could you look side to side, please? And could you touch your ear to your shoulder, please? And the other side. And there is full range of motion. Could you move your head back and forward, please? All right, so there is full range of motion in the neck. I am going to assess for the strength. Could you please push against me? And this side, and this side, and this side. Could you shrug your shoulders for me, please? All right. So the strength, the strength in the neck muscles is 5 out of 5. So next I am going to move on to the anterior thorax, and I am going to start with the cardiovascular and the respiratory exam. So before we get started, do you have any chest pain?
No.
Any shortness of breath?
No.
All right, so my patient would be on a hospital journey, so I'll be looking at his skin directly, but for purposes of this video, we're going to keep his clothes on, and I am going to inspect the precordium for skin color, any rashes, any pulsations, any heaves, thrills, and I am going to inspect the shoulders for symmetry, any retraction, any use of accessory muscles. And throughout the whole exam, my patient hasn't been in any respiratory distress. I do not see any use of accessory muscles. There is no lesions, no heaves, no thrills, and the skin color matches ethnicity. I don't see any pulsations either. So next, I am going to palpate the precordium for any thrills, heaves, any tenderness, or masses. I am also going to palpate the sternum, the clavicles, and the ribs for any tenderness or masses. Do you have any pain?
No.
The ribs, any pain? The clavicles, the sternum, do you have any pain? All right, so there is no tenderness or masses, and patient denies any pain. I am then going to auscultate the 10 lungs. I'm going to listen for the 5 heart sounds, and I am going to listen for S1 and S2. I am going to use the diaphragm side of my stethoscope, and again, for this would be right on the skin, but for purposes of this video, this is going to be over the clothes. And I'll begin with the aortic area, which is on the right sternal border, second intercostal space. Okay. And then move on to the pulmonic area, which is on the left sternal border, the second intercostal space. And I'll move on to the abs point, which is on the left sternal border, third intercostal space. And then the tricuspid, which is on the fourth intercostal space on the left sternal border. And then finally the mitral area, which is on the fifth intercostal space. That's the mid-clavicular line. And while I'm here, I'll also palpate the PMI, which is on the fifth intercostal space. Okay, and I am also going to auscultate the trachea for any stridor. Could you please lift your head up? Again, I'm using the diaphragm of my stethoscope. Okay, there are no stridors. And while I'm still in this position, I am going to listen for the 8 lung sounds. The first 2 are the bronchovascular sounds, and the next 6 are the vascular sounds. Could you take a deep breath, please? Okay. Deep breath. Okay. Finally. All right, so there is a regular rate and rhythm in all the 5 heart sounds, and positive S1 and S2, and the bronchovascular and the vascular sounds are clear. And while I'm still at this, just to go back to the nose, could you please occlude one nail and close your eyes for me, please? What do you smell?
Coffee.
All right, and this side, please. Smell.
Coffee.
All right. Okay. So next, I'm going to move on to the abdomen. And before we do this exam, do you need to use the restroom?
No.
Do you have any pain or discomfort?
No.
All right. So I am going to begin by inspecting the abdomen for skin color changes, any lesions, any scars. Excuse me, any striae, and for symmetry. And upon inspection, and of course this would be right on the skin, but for purposes of this video we're doing it over the clothes. The patient does, the skin color matches ethnicity. I don't see any striae, no piercings, and no lesions or scars. So next I'm going to auscultate and listen for the bowel sounds. And I'm going to use the diaphragm side of my stethoscope. And I'll start with the with the right lower quadrant. Again, this would be right on the skin. And I'll do this in an S pattern. And then I'll move on to the right upper quadrant. And I'll move on to the left upper quadrant in an S pattern. And finally the left lower quadrant. All right, so the patient has active bowel sounds, and so next I'm going to palpate the abdomen for any tenderness or masses, and I'm just going to do a light palpation. Do you have any pain?
No.
Okay, so there is no tenderness or masses, and patient denies having any pain. I am then going to move on to the musculoskeletal and peripheral vascular exam, and so I am going to begin by inspecting the skin color, any lesions. I'm going to inspect the elbows, the wrists, the hands, and the fingers for capillary refills. And I am going to inspect the shoulders, and I'm basically going to inspect the upper extremity joints for symmetry. So upon inspection, the skin color matches ethnicity, there is no lesions, the upper extremity joints are symmetrical. I am then going to palpate. I am going to palpate the radial and ulnar pulses. So the radial pulse is 15. When you multiply that by 4, it's within regular findings. I'm going to palpate the ulnar pulse, and it's +2. I'm going to assess for capillary refills. in all the 10 fingers. And capillary refills are less than 2. I am going to palpate the upper extremity, the shoulders, all the way to the hands. I'm palpating for temperature, any tenderness, any masses. Do you have any pain?
No.
All right, so the skin feels dry, warm, and intact, and there is no tenderness, no masses. I am then going to move on to test for upper extremity strength, and let's start with abduction and adduction. Could you please stretch your arms out, please? And adduct them, bring them back down. Do the same thing, please, and we're testing for strength. Push up against me and push down against me. All right, and then flexion, and extension of the elbows. Could you flex your elbows, please, and extend them, please? All right, and I'm going to assess for the strength. Could you flex? All right, push up against me and push. So there's full range of motion in the upper extremities, and the strength is 5 out of 5. I am then going to assess the pronator drift. Could you please stretch your hands out with your palms facing up, and close your eyes, please. And okay. So there is negative pronator drift. All right. So I'm done with this. I'm then moving on to the neurological coordination for the upper extremities. I am doing this to assess for the cerebellar function, and I am going to assess your finger to nose rapid movements. So you're going to touch your nose and touch my finger. Okay. Okay. Keep doing. All right. So the patient is able to follow directions. Could you use your fingers to touch your thumbs? And the other side. All right. So I don't see, the patient is not fumbling. He's able to touch. All his fingers are able to touch his thumb. So I am now moving on to the lower extremities. And do you have any joint pain?
No.
Any numbness or tingling in the lower extremities?
No.
All right, so I am going to inspect for the skin color, for any lesions, I'm going to assess the capillary refills of the toes. I am going to inspect the hips, the knees, the ankles, the toes, and I am going to assess for symmetry of the extremities and for any deformities. And upon inspection, the skin color matches ethnicity. I don't see any deformities, and the lower extremity joints are symmetrical, and there is I don't see any scars, and I am then going to palpate the hips, the knees, the feet, and the toes for temperature, tenderness, any crepitus or edema. And again, this would be right on the skin, but for purposes of this video, I'm leaving the clothes on. And the skin feels warm, dry, and intact. Do you have any pain?
No.
All right, so patient denies any pain. There is no tenderness, no edema. I am going to palpate. I'm going to palpate the legs for any edema and the feet. So there is no edema in the lower extremities. I am then going to assess for range of motion in the lower extremities. Could you please stretch out your legs for me? All right, and push them back. All right, now I'm going to assess the strength, the resistance against my hand. Push, 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 and push, push, push. All right, that was flexion, and yep. So next I'm going to assess the plantar and dorsiflexion. Could you point your feet up to the ceiling, and could you plant them down to plant your feet down plant them, your feet, plant them down. All right, good. So I'm going to assess the strength. Could you push against me and jog with your feet up? All right, so there is full range of motion, and the strength is 5 out of 5 for the lower extremities. I am then moving on to the neurological coordination for the lower extremities, and I am going to assess the shin to heel, the heel to shin test. Could you please pull your heel up your shin like that, and do it on the other side? All right, so the patient is able to pull his heel to the shin. So thank you. All right, so next I'm going to move on to the posterior thorax, and could you turn to this side, please? All right, so for the posterior thorax, I am going to begin by inspecting for any skin color changes. He is not in any respiratory distress. I am going to inspect for any lesions, any scars, any musculoskeletal deformities, shoulder symmetry, retractions, or use of accessory muscles. And upon inspection, there is no accessory muscle use. I don't see any retractions. The skin color matches ethnicity, and there is no lesions or scars. Next, I am going to inspect the shape of the posterior thorax, and so the posterior thorax diameter is 1 to 2. Next, I am going to palpate the cervical and the thoracic spine, and the scapula and the ribs for any tenderness or masses or pain. Do you have any pain?
No.
All right. And the ribs, any pain?
No.
All right. So there is no pain or tenderness, and there is no masses. So next I'm going to auscultate the 10 lung sounds. I'm going to identify the first 4 will be the bronchovascular, and the last 6 will be the vascular sounds. Oh, can you, Rodney, turn to this side. Sorry. All right, so the 10 lung sounds, I am going to use the diaphragm of my stethoscope, and this would be right on the skin, but for purposes of this video, I'm doing it over the clothes. Take a deep breath. Deep breath. Deep breath. Keep taking deep breath as much as you can. All right. So the bronchovascular sounds and the vascular sounds are clear, and I don't see any. The patient doesn't seem like he's in any respiratory distress. I am then moving on to the spine. Could you please stand up and face the camera, please? So I am going to begin by inspecting the spine for any curves, any masses. I am going to inspect for any deformities. Could you please lean forward? And with my patient in this position, I do not see any deformities, and the spine is midline, and there is no curving. All right, so we're going to assess for full range of motion for the spine. Could you please get up? All right, so we're going to, you're going to bend down and back up, and we're going to do lateral bending. That's side to side, side, and then rotation. That's that. So there's full range of motion in the spine, and of course it's midline, and then we are finally moving on to neurologic exam of this, and I am going to do the Rombat test. Could you please put your arms straight, close your eyes, and all right, I'm then going to assess. I am going to observe the gait. Open your eyes, it's okay. I'm going to observe the gait and heel, the tandem walking. So you are going to walk like your heel to your toe, your heel to the camera. All right. So the patient is able to tandem walk safely, and there is smooth gait. So that brings us to the end of my video, my exam. Thank you so much.